You are welcome to Claribel Health Hub. Your presenter this morning is myself, Clarice. And I'm bringing to you some health practices we have learned during this COVID era that we will need to carry them along with us into the subsequent years ahead for a healthier and better life. When the pandemic arose, we were all scared and we were all right down into our rooms and into our homes. We were not going to work, we were not going to school. There was nothing, but health workers were still out and going out to work. We thank God. Unfortunately, some passed, but majority are still around with us. And there are things they have done which have been tested and known to be proven ways to a healthier life. So, let's get rolling. I'll plead with you to subscribe to this channel, like us, view, and share our videos for more of such healthy videos. You are welcome to Claribel Health. One has been on personal hygiene. There have been a number of hygienic practices we have learned. Some we knew, but we're not doing it religiously. Now, hand washing has been one of the things we all are learning to do, and it has been a proven route as to reduce and break infections. The hand hygiene techniques involve two main things: using soap and water to wash your hands, or using 70% alcohol-based hand sanitizers. These are proven and proving means of reducing germs and infection transmissions. How do we wash our hands? When you go to WHO website, you realize that they have given out the various steps to wash our hands properly. Paying attention to all folds and corners of your hands and your fingers, paying attention to the folds in between the fingers, our rings, making sure we wash around it and beneath it, making sure we have washed all our thumbs properly. The most appropriate means of hand hygiene to most of the documentaries around has been hand washing. However, we can still use the alcohol-based hand sanitizers when water and soap is not available. Please note that there are some instances there is no way for you to use a hand sanitizer. It would be most appropriate to use soap and water. For example, when you are about to eat, when you have finished eating, when you have finished attending to a baby diaper, when your hands are physically soaked, these are times you will by all means need to wash your hands with soap and water. But in regular daily attending to people, meeting new persons, handling phones, handling doorknobs, it will be appropriate to use our hand sanitizers. We will also recommend that in taking care of our personal clothing, even in public places, we remember to wash our clothes and other linens with soap and water and dry them. Those in the wet zones, it's recommended that you use high temperature of water to wash our clothing. But most scientific basis will tell us our regular detergent and water, it's good enough to render our clothes of all other disease-causing organisms. Also, we must note this, that when we are coughing or sneezing, we will need to cover our cough and sneeze. For example, blowing into the elbow or covering with a handkerchief or a tissue, which will be discarded after use. Let's also remember to avoid touching our faces, especially our eyes, our nose, and our mouth. You might have forgotten that you have not cleaned your hands. And in fact, sometimes your hands are not that clean, but you assume they are clean because you can't really see the germs that are roaming around your hands. Anytime you have not washed your hands and you keep walking around your face with your hands, you have the chance of transmitting any other virus to yourself. Also to be recommended are environmental hygienes. 1. Let's remember to clean all working surfaces at the beginning of each day and at the close of work. We will use 0.05% of bleach or parasol. This is able to kill all working organisms, including viruses, on our worktops. Also, in between work, 2 to 3 hours, we can use the alcohol-based hand sanitizers to sanitize our work surfaces and worktops. Let's remember, all things, equipment, and tools that we keep sharing, like hand phones, like mobile sets, like our laptops and computers. Let's remember in between working times to clean with alcohol-based sanitizers. It will help us reduce transmitting infection from one person to the other. Also, it's important that at the end of each working time, we can disinfect our environment. There are a lot of disinfectants currently on the market, which we can get in the open market, that at the close of work, we can spray our offices before we go out. However, we should remember, for all locations and programs, most preferable place to have them is in the open air, where in a part of the world we have a lot of sun, which does us a lot of good by reducing a lot of the microbes we have in the environment. It's also important that from time to time our work surfaces in the kitchens are not neglected. Before cooking and after cooking, do well to clean the working tops in the kitchen. When you come home with your marketing things that you have bought, tins of fish, tins of milk, tins, and all sort of things that we come home with, even in the plastic bags, let's do well, clean them thoroughly with soap and water before packing them away. For vegetables, we only might need salt solution to get them clean before we package them in sealable bags and freeze. In these days and times, when you are not feeling well, it's recommended you stay at home, especially with symptoms of flu, having a cold, stuffy nose or runny nose, having a cough. We have what we call catarrh or cold in a part of the world, having fatigue and other flu-like symptoms. It's recommended you stay at home and avoid as much as you can going into gatherings. If there is the need for you to do that, do well to remember to put on your mask. The pandemic has introduced us to a number of masks, which were usually not part of the working system, especially among health workers. So now we have the medical or surgical mask, we have the fabric masks, and then we have the various N95 respirators as well, which are all recommended for various use at specific times in our working life. For health workers, it's usually N95 respirators and surgical or medical mask. For us within the communities, surgical mask and fabric mask are the most recommended. Thank you for watching our video. Do remember to subscribe, share with family and friends, and keep watching.